Episodic Future Thinking in General Anxiety Disorder by J. Wu and colleagues, 2015. This study was able to measure episodic future thinking, and Jade Wu and her colleagues found the significance of this study is that it goes a long way to understanding episodic future thought. And if episodic future thought can be measured, then it possibly can be modified in a clinical setting to evoke more positive future thoughts rather than ones of worry and negativity. This experiment was a recombination procedure where Jay Wu and her colleagues used past cognitions from the participant's life as a cue for them to create personalised episodic future thoughts. This was done over 3 sessions, and a within-group t-test was used to compare the results of the 2 groups, one being a control group of healthy individuals and the other group having a diagnosis of general anxiety disorder. There were 40 adults recruited from the Boston community, of which 21 met the DSM-5 diagnostic criteria for general anxiety disorder and 19 did not. There was a clinician-administered diagnostic interview for the screening where participants had to do self-reporting questionnaires to determine suitability to the study. Questionnaires that were used included the demographics questionnaire, the Penn State Worry questionnaire, and the Beck Anxiety Inventory. The experiment went for 3 sessions. In the first session, participants were asked to generate 110 familiar people, 110 familiar places, and 110 familiar objects. This was so Jade Wu and her colleagues could create individual personalised cues, which consisted of these 3 elements in order for them to create episodic future thoughts in Session 2. In Session 2, this cue triad was presented alongside positive, neutral, or negative stimuli. Participants were asked to simulate a positive future episodic experience. They were then asked to describe the event by writing down a brief sentence. In the third session, participants had to re-simulate half of the previously generated events 3 times. This was done by using the sentence participants wrote down to identify the episodic future thought from Session 2. Then participants were to re-simulate all 90 events one more time, half from the day before and half from the previous 3 trials that day. Participants then had to rate on a scale from 1 to 5 the plausibility that the event would actually occur, the detail of their episodic future thought, and how easy it was to simulate, the arousal that was evoked from the trial, and then participants were debriefed and compensated for their time. What this study found was that participants with general anxiety disorder were able to generate negative scenarios with greater ease than the control group. Negative events were rated more plausible by participants with general anxiety disorder, and Jade Wu and her colleagues' hypothesis was proven correct. They also identified worry to be primarily involved in the episodic future thinking of participants with general anxiety disorder. Worry can be seen as an extension to episodic future thinking, which produces more negative rather than positive events. Some of the implications of this study is that it highlights the need for further research on positive cognitions in anxiety disorders, and episodic future thinking can be used as a tool to modify this in a clinical setting. It is important to consider how individuals with general anxiety disorder think about future events, as worry and episodic future thinking are distinct processes, that being excess worry and the deficit in simulating positive episodic future thoughts. Repetition does not increase ease in simulation of episodic future thinking in individuals with general anxiety disorder. Some of the strengths of this study can be seen in the way that being able to measure episodic future thinking could lead to future research on how to modify episodic future thinking. This was the first study of its kind to successfully measure episodic future thinking in individuals with general anxiety disorder. However, this brings about one of the limitations of the study, as this experiment will need to be replicated and repeated to ensure validity and consistency. Some of the limitations is that all participants were recruited from the Boston community, whereby socioeconomic status among participants may be a contributing variable that was overlooked. There is also the reliance of the self-reporting questionnaires. Depressive symptoms were not evaluated in the analysis, which could also compromise the integrity of the control group being healthy. In conclusion, this study is the first to assess the ability of individuals with general anxiety disorder to simulate episodic future thinking. With the use of experimental recombination procedure, Jade Wu and her colleagues demonstrated that individuals with general anxiety disorder are less likely than their non-anxious counterparts to add detail with repetition of simulating future events, and do not find positive events increasingly easy to simulate as their non-anxious counterparts do. The findings in this study advances our understandings of future-oriented cognitive processing in general anxiety disorder and may have implications for clinical practice. Thank you.